Have you ever stopped to think that certain types of leafy greens can pose a serious health risk for older adults? That's right. While many believe that all vegetables are beneficial, the truth is that some leafy greens can actually cause digestive issues, weaken the immune system, and even lead to severe intoxication. The idea that the greener, the better doesn't always apply to those over 60 years old. And what's most concerning? These foods are present on the plates of thousands of Brazilians every day. Could it be that you or a family member is consuming one of these vegetables without knowing the danger it poses? In today's video, you're going to discover 7 leafy greens that are not recommended for seniors and understand why they should be avoided. Some harm intestinal function, others affect the kidneys, and there are even some that interfere with the absorption of essential nutrients. Stay with me until the end, because I'll show you safer options to replace these greens without compromising a balanced diet. I'm Dr. Benicio, and let's get straight to the point. First on the list, spinach. Although widely known for its high levels of iron and vitamins, spinach can be harmful for older individuals. The main reason is the high concentration of oxalic acid present in this vegetable. This substance can lead to the formation of kidney stones, especially because, as we age, our kidneys lose some of their ability to eliminate toxins efficiently. The buildup of this acid encourages the formation of painful kidney stones. Additionally, it interferes with calcium absorption in the body, which poses a risk for those suffering from osteoporosis or bone fragility. Another important point is that spinach can cause gastrointestinal discomfort, such as gas, bloating, and even make it harder to absorb iron when consumed in excess. In other words, someone adding spinach to their diet to fight anemia may unknowingly be hindering their own treatment. Second vegetable, eggplant. Although eggplant is often praised for its positive effects on cholesterol control and digestion, it can be problematic for older adults. This is due to solanine, a natural compound found in eggplant, as well as in other foods from the same family, like tomatoes and bell peppers. In some individuals, this substance can cause joint inflammation, worsening symptoms of conditions like arthritis and osteoarthritis. Furthermore, eggplant can be difficult to digest, especially when fried or poorly prepared. For those with a more delicate digestive system, such as seniors, it may cause discomfort like acid reflux, heartburn, and stomach irritation. It's also worth mentioning that this vegetable contains histamine, which can trigger mild allergic reactions such as itching, headaches, and swelling in more sensitive individuals. Third on the list, okra. A very common ingredient in Brazilian cuisine, okra can pose hidden risks for seniors. The main concern lies in the fructans, a type of fiber that is not always well tolerated by those with sensitive intestines. This substance can cause gas, abdominal distension, episodes of diarrhea, and pain, especially in those who already suffer from digestive disorders such as irritable bowel syndrome. Another worrisome factor is the presence of oxalates in okra, the same compounds found in spinach, which can contribute to the development of kidney stones. For those already prone to this issue, regular consumption of this vegetable can worsen the condition. Moreover, okra contains gossypol, a compound that can interfere with iron absorption in the body. For seniors with low iron reserves, frequent consumption of okra can further worsen anemia. Fourth vegetable, watercress. Although valued for its strong flavor and antioxidant properties, watercress can be harmful for older people, especially those with thyroid dysfunction. That's because it belongs to the cruciferous family, which is rich in compounds called goitrogens. These substances can reduce iodine absorption and negatively affect the performance of the thyroid gland, contributing to the development of hypothyroidism. Another point of concern is that watercress can irritate the stomach lining, causing burning sensations, heartburn, and even gastric inflammation, especially in those already dealing with reflux or gastritis. And that's not all. As a rich source of vitamin K, it can interfere with the action of anticoagulant medication, increasing the risk of thrombosis or bleeding in people who use these drugs. Number 5. Collard greens. One of the most popular vegetables on Brazilian tables, Collard greens may hide serious dangers for older adults, especially for those who have thyroid gland disorders or a predisposition to kidney stones. As with watercress, collard greens contain compounds known as goitrogens, which hinder the proper production of thyroid hormones and may lead to hypothyroidism. Another issue is that collard greens contain large amounts of oxalate, a substance that promotes the formation of kidney stone. This represents an even greater risk for those who already have difficulty eliminating waste and toxins through urine. Not to mention that this vegetable can cause gas and bloating, as it is rich in fiber and sulfur compounds that tend to ferment during digestion. For seniors, who usually have a slower and more delicate digestive system, overdoing it on collard greens can cause intestinal discomfort, such as constipation or a bloated belly sensation. Number 6. Iceberg lettuce. Contrary to what many people think, not all types of lettuce are the same. The iceberg variety, although widely consumed, may not be the best choice for older adults. That's because it has low nutritional density. In other words, it offers few real benefits to the body, and it is among the leafy greens most exposed to harmful agricultural chemicals, which is especially concerning for those with compromised immunity. Another issue is the significant amount of insoluble fiber present in this type of lettuce, which can make digestion difficult for people who already face intestinal problems. This can trigger episodes of cramping, loose stool, and abdominal bloating in more sensitive elderly individuals. Moreover, iceberg lettuce is rich in vitamin K, which can interfere with the effectiveness of blood-thinning medication. For those on anticoagulants, consuming too much may reduce the efficacy of the medication and increase the risk of blockages or unexpected bleeding. Number 7. Radish. Although it has a mild flavor and is often used in salads, radish can be problematic for older adults. This is due to its high content of sulfur compounds, which can lead to excessive gas production, abdominal bloating, and intestinal discomfort, especially in those dealing with gastritis or disorders like irritable bowel syndrome. Another relevant aspect is its naturally diuretic effect. For seniors who already suffer from low blood pressure or who are prone to dehydration, this vegetable can worsen the condition by promoting the loss of essential minerals like potassium and sodium. This may result in symptoms such as muscle fatigue, cramps, weakness, and even dizziness. Not to mention that radish belongs to the same cruciferous family as watercress and collard greens, and it can also interfere with iodine absorption, impairing thyroid function, and increasing the risk of hypothyroidism in those already predisposed to this kind of hormonal imbalance. Now that you know which leafy greens can pose risks for those in their golden year, it's time to apply this knowledge to your daily life. The idea that every vegetable is healthy can lead to choices that, in practice, overload important organs like the kidneys, cause intestinal inflammation, or disrupt hormonal balance. But don't worry, there's no need to eliminate these greens altogether. The best approach is to reduce how often you consume them, and, when possible, replace them with safer alternatives such as escarole, arugula, or romaine lettuce, which are better tolerated by people over 60. Also, always wash your vegetables thoroughly, and, if possible, choose organic foods to avoid the negative impacts of pesticides. Now tell me, are any of these vegetables part of your daily diet? Have you noticed any discomfort when consuming any of them? Share in the comments, because your story might help many others who are going through similar situations. And if you enjoyed this content, make sure to subscribe to the channel and activate the notification bell to keep receiving practical tips for a healthier life. See you in the next video.